Hi, I'm Lajja, one of the dentists at 1 Wood Street Advanced Dental Care, and I've been asked to speak to you today about what you can expect from your first appointment with us at the practice. When you arrive, you'll be welcomed by one of our receptionists, and you'll be asked to fill in some administrative paperwork on one of our digital pads. This ensures we have all your contact details correct, and we will ask you to complete our medical history questionnaire. This will be a series of questions about any current medications, allergies and medical treatment you may have had or may be having. Once all of this is completed and the information has been transferred through to our computer, either myself or Natalie, my nurse, will call you through to our room. I'm likely to begin by asking you to explain any specific dental concerns that may have brought you to our practice, and we will also have a chat about when you last went to the dentist and what you hope to achieve with regards to your teeth and gums going forward. We'll run through the medical form that you filled in for us, and I'll ask you a few questions about your past and present social history. By getting an idea of your occupation, smoking and alcohol history, I can get an idea about any risk factors that may predispose you to certain medical and dental conditions. I'll ask you about your current dental hygiene habits, namely what toothbrush, toothpaste, mouthwash you use at present. And we'll then ask you to put on our safety glasses and we'll recline back the dental chair. I will start by conducting what we call an extra-oral examination. During this, I'll check your jaw joints for any clicks or creaks, your facial muscles, and under your chin and neck for any lumps or abnormalities. I'll then move on to the intraoral soft tissue check. I will have a good look inside your lips, cheeks, palate, on top and underneath your tongue, making note of any ulcers or unusual lumps or bumps. And then we'll move on to assessing the teeth themselves. I will use a tip that produces a gentle stream of air and a dental mirror to have a good look around your teeth and gums. It is important that on your first visit, we make a good note of what your teeth look like at that time. So, with Natalie on the computer and using a code which is a series of numbers and letters, I will run through initially which teeth you have, and taking each tooth at a time, make a note of any restorations that you may have, whether that's fillings, crowns or implants. Throughout this, Natalie will be typing away on the computer to create a baseline record of your teeth. Once this is done, we will then check for any broken teeth or fillings or any cavities, and again, she will make a note of this. We will then complete a few further checks, one of which assesses the health of your gums using a blunt-ended instrument. This is to screen for gum disease, which unfortunately is still a very common reason for tooth loss. So, by identifying those patients with the signs of it, we can begin to implement the steps needed to slow the rate of the progression of the disease. We'll also check for any wobbly teeth, any signs of tooth wear, and we'll assess how your teeth bite together. After this, I'll pop the chair back upright and I will try my best to describe what I think the current health of your mouth and gums are, as well as any issues that I think may need to be addressed. We will then decide if you need to take any dental x-rays, three-dimensional scans or photographs which may assist us to formulate your individually tailored treatment plan. We will discuss what options you have available to manage any issues you may have and where we proceed going forwards. We're in a very fortunate position at 1 Wood Street to be a specialist referral practice, so should we feel that you are best treated by one of our colleagues, whether that's Becky or Naomi, our hygienists, or one of our specialist dentists, we can make arrangements for this to be done within the practice itself. And we will provide you with an itemised treatment plan and give you any consent forms for the treatment we have discussed, and then we'll ask you to pop back out to reception to make any follow-up appointments which we may need to get arranged. Finally, I'd like to take the opportunity to say that at 1 Wood Street we fully appreciate that for some people a trip to the dentist isn't exactly the highlight of their day. We ensure our absolute best to make the visit as pleasant as we possibly can for you, and we will ask you about any personal fears or phobias you may have developed, and we'll endeavour to do what we can to make your visit as enjoyable as possible, and we hope that upon leaving you look forward to coming back to seeing us rather than worrying about it. Thank you for taking the time to listen to me today, and we look forward to welcoming you to our practice.